Now our topic of discussion is the hemostasis. What is hemostasis and what processes are involved in the hemostasis? Let's start. Hemostasis is basically formed by two words. Hemo means blood and stasis means stoppage. It means stoppage of blood. Right. Hemostasis is basically when injury occurs, then a process which occurs in our body is the hemostasis. Due to this, the injured blood vessels is blocked and the wound is repaired. So let's see what processes are involved in the hemostasis. There are 5 processes which are involved in the hemostasis. First one is the vascular constriction. Second one is the platelets clot formation. Third one is blood coagulation. Fourth, fibrous tissue. And fifth, clot retraction and serum expression. Right? When injured occur, then the blood vessels contract to reduce the blood flow to the sides of the injury. Then different platelets come and form a plug over the injured area. There are different processes which are involved in the platelets plug, like adhesion, aggression, release, reaction. And then blood coagulation factor involved. There are two pathways due to which blood coagulation factor activate: extrinsic or intrinsic. Both pathways have the same role. They actually form fibrin from the fibrinogen, and they help in the further stoppage of the blood from the injured area. Then fibrous tissues, the injured area convert into the fibrous tissues, and then clot retract, contract. As this is actually a practice you see in the daily life. Then there is wound occur, and after repairing the skin contract over the wound. This is the process, and sometimes a liquid comes out after the fillings of the fluid, which is actually the serum. One by one we will discuss it in more detail. First, we will discuss vascular constriction. How vascular constriction occurs and what is the purpose of the vascular constriction. Before we will discuss vascular constriction, first we see the basic structures of the blood vessels. Blood vessels are having 3 layers. First one is the tunica intima, second one is the tunica media, and third most outer layers of the blood vessels is the tunica adventitia. Tunica media having from inside having the endothelium layer, and next to the in tunica media having the endothelium layer, and next to the endothelium is the subendothelium. Next, right next to the let's suppose this is the subendothelium, and this green color is the this is the endothelium, and next to the subendothelium. And then this is the tunica intima, which is mainly having contained different myocyte muscles containing layers. And then last one is the tunica adventitia. Right. First, local myogenic spasm. When the injuries occurs, this is the injured of the blood vessel. After the injury, the muscles which is present in the tunica intima contract or spasm occur, due to which the flow of the blood to the injured site is reduced and the surrounding blood vessels also reduce in it. And second one is the local autacoid factor. There are several factors released after the injury. First, like autacoid. Autacoid are basically the hormone-like structures which is released and have different functions, localized function, like thromboxane, A2. This is the thromboxane A2 having the function, and it attracts the platelets to the injured site. Like this is a platelets which attached to the injured site, and these platelets release the thromboxane A2, which further attached to different platelets over them. Like ADP is also involved in the attraction of the platelets and the formation of the plug occurs. And third one is the nervous reflexes, and as you know that the blood vessels having different types of nerves, which is mainly the pain nerve and the sensory impulses. Due to the vessels also constrict, and after the receiving the message from the brain. To summarize this vascular constriction, you have to remember that traumatized vessel directly proportional to vascular spasm. If greater damage occur or trauma occur, then the vascular spasm is increased. And if the traumatized vessel or the trauma is lesser, then the vascular spasm is also lesser. Next, we will see diagrammatically these 5 processes which occur actually in the hemostasis. Like this is a cute boy which is smiling in front of you. This is a boy like ABC. He is walking, or you can say he is playing in a ground, and after during playing he fell down and get injured. After this is he get injured on his hand. As you see, this is a blood vessel, and blood vessel is ruptured. This is a skin surface which is shown by the green area, and this is a blood vessel. Blood vessels, as I told you before, blood vessels having 3 layers in it, and this is the 3 layers of the blood vessel. Tissue damage also occur. First tissue damage occur, and then the blood vessels. As you see, just after the injury, the vascular constriction occurred. It means flow of the blood to the area of the injury reduced due to the contractions of the blood vessels or blood vessel cells. As this is normally occur after the injury. Then the platelets plug formation. What is platelet plug formation? It means that lot of platelets come at the injured site. Like this is a platelets which come to the injured site, and as you know that this is the endothelium, and then to the subendothelium. Subendothelium has lot of collagen present in it, and these collagen attract the platelets. Let's suppose this is a platelets which attach to them, and after attaching they changes in shape, like there are different pseudopods, like this is a platelets. After attaching they change their shape like this one. Different pseudopod produced from its membrane. Then as you know, during platelets plug formations, first process is adhesion. Adhesions mean the attachments of the blood vessels to the endothelium, right? And aggregations mean this first platelets which is attached to the endothelium further attracts other platelets to themselves. Like other platelets attract, as you know, how? But because thromboxane. This first platelets, this is a first platelets release thromboxane or ADP, as we have discussed in the previous lectures that the platelets having granule, electron dense granule which having the ADP released by the platelets and attracts more platelets, and more platelets attached to the number one platelets, and after plugging to this they form a this is called the aggregation. Adhesion means attachment of the platelet to the endothelium, and aggregations mean attachment of the platelets to themselves. And after them, a release reaction is occur in which the calcium ion concentration is high, which further accelerates the strengthen the plug formation, which we will discuss in the next coming video in more detail. Second one is completed like a plug, platelets plug is formed in it. Then the coagulation cascade occur, or coagulation occurs. Why? This is a platelets plug which forms at the injured site, right? This is a platelet. You can also see at the outer surface of the skin, right? But this is not as strength to strength further, or to further leakage of the blood cascade, which is called coagulation cascade occur. It can be either extrinsic or intrinsic. It means outside to or inside. If the damage occur outside, then it is called intrinsic, and if it is occur in inside, then it is called intrinsic. Coagulation, as I have told you that fibrinogen is converted into the fibrin with the help of the process is extrinsic or intrinsic. Fibrin then enmesh to them. This is a fibrin which is shown by the blue color. Blue color is called fibrin. This is a fibrin. Up now. There is a clot form in it, and as you know, different blood cells flowing through the vessels like red blood cells and other platelets, then during their movement they also attach to them. They enmesh, they captures other red blood cell to themselves, and there is a formations of the clot. Then as you see, this is a clot formations occur, and also fibrin is enmeshed in them, right? But there is a problem. This clot is convert into the fibrous tissue. As you see, when injury occur and after healing, the skin at the injured site is not as same as the previous one. There is a scar formation. It means that scar is basically due to the conversion of the clots into the fibrous tissue. There are a lot of fibroblast come and convert these clot into the fibrous tissues, right? And as last one is this is a clot, and there is a different fibrin. But now after the healing, or almost completion of the healing, like this is the skin which is almost healed by the hemostatic process. Last one is the wound is contract. Why? As you know, this clot having lot of platelets in it, and these platelets, as I have told you in the previous lecture, that the platelets, this is a platelet which having different proteins in it, like actin, myosin, and thrombocysteine. These actually the contractile protein which contract. When they contract, they actually contract the overall clot forming at the injured site. They contract the skin which is present over the clot. So that this is the 5 process which is involved in the hemostasis, and due to this is a very this process having very different advantages. If this process is not occur, then blood continuously loss from the body and eventually death occur, right? So this is the lectures about the general information about the hemostasis. Next we will discuss in further detail like platelets, plug formation, coagulation, and so on. Thank you so much.